Today's topic is Hemophagocytic Lymphohistiocytosis. Welcome to our channel Internal Medicine Made Easy, the online learning platform that provides medical education to healthcare professionals and students to improve their clinical skill and help them in their studies, courses, careers, and research. Hemophagocytic lymphohistiocytosis, or HLH, is a rare and life-threatening hyper-inflammatory syndrome characterized by an uncontrolled immune response. This syndrome results in excessive activation of immune cells and cytokine production, leading to severe multi-organ damage and, if left untreated, a high mortality rate. HLH can occur in both children and adults, presenting either as a primary genetic disorder or a secondary response to various triggers such as infections, malignancies, or autoimmune disease. Etiology. HLH can be categorized into two main types, primary and secondary. Primary HLH typically manifests in early childhood due to genetic mutations affecting immune cell interactions. Secondary HLH occurs in adults, triggered by acute illnesses, most commonly infections, malignancies, or autoimmune disorders. Epidemiology. Accurate prevalence data for HLH is challenging to obtain due to diagnostic criteria variability and overlapping clinical presentations. Primary HLH has an estimated yearly incidence of roughly 1.5 per million in children, based on a Swedish national registry. Secondary HLH is more challenging to estimate accurately, but it may affect approximately 1 in 2,000 adult critical care admissions. No specific racial or ethnic predilection is observed. Pathophysiology. HLH is characterized by dysregulated innate immune responses involving NK cells and CD8 plus cytotoxic T cells. Disruptions in immune cell interactions and genetic mutations lead to ineffective target cell destruction and a cascade of inflammation, resulting in macrophage activation and systemic damage. Key proteins involved include perforin and granzyme, and cytokines such as interferon gamma, tumor necrosis factor, and interleukin 2 play critical roles in disease progression. Histopathologically, HLH is characterized by hemophagocytosis, where macrophages engulf bone marrow cells, although it is not always present. Biopsy of lymph nodes, bone marrow, or spleen is typically conducted for suspected cases. History and physical examination. Patients with HLH present with non-specific symptoms such as fever, malaise, fatigue, and signs of systemic inflammation. Physical examination findings may include cytopenias, hepatosplenomegaly, adenopathy, altered mental status, respiratory distress, acute liver and renal failure, and signs of extreme anemia. Evaluation. Diagnostic criteria have evolved with HLH-94 and HLH 2004 being prominent classification systems. The criteria encompass a combination of clinical, laboratory, and histopathological findings to establish a diagnosis. Treatment and management. The mainstay of treatment involves immunosuppression and cytotoxic therapy, though contraindicated in severe infections. The HLH 94 and 2004 protocols outline treatment strategies, including medications and potential bone marrow transplant in selected cases. Regular monitoring, a multidisciplinary approach, and prompt diagnosis are crucial for effective management.